She had been mocked for 3 months straight, called slow, called cold, called the Glacier behind her back by doctors who thought she couldn't hear them. Elena Cross wore plain scrubs, moved without rushing, and never once raised her voice in the ER at Riverside Haven Medical Center. They thought she was mediocre. They thought she was barely qualified. Then a military helicopter crackled over the hospital radio at 6:47 in the morning, and a pilot's voice cut through the static like a blade. Riverside Haven, confirm Commander Vasquez is on premises. We have 3 critical inbounds, ETA 11 minutes. 30 people in that emergency room turned, slowly, then all at once, toward the quiet nurse standing by the supply cart, who had just set down her clipboard and closed her eyes. If this story already has you leaning forward, do me a favor. Hit follow so you don't miss what happens next. Give this a like if you think Elena deserves better, and drop a comment telling me what city or country you're watching from. I want to see how far this story travels. The radio call came in at the tail end of the overnight shift when the ER was running on recycled coffee and irritation. Elena had been restocking the trauma supply cart for 20 minutes, moving methodically through the checklist the way she always did. Gauze, saline bags, laryngoscopes in the right order, nothing skipped, nothing doubled. Around her, the morning crew was filtering in, peeling off coats, trading complaints about parking and the busted vending machine on the second floor. It was the kind of early morning when the building felt too big and the fluorescent lights felt too honest, and nobody was particularly happy to be there. Doctor, Marcus Whitmore swept through the double doors at 6:44, already wearing his surgical cap like a crown. He was the kind of man who made an entrance even when no one was waiting for one. Broad shoulders, a voice that carried 3 rooms over, and the particular confidence of someone who had spent decades being the smartest person in the spaces he chose to occupy. He dropped a chart on the nurse's station desk without looking at who was standing there. Cross. He didn't look up. I need the Delgado labs pulled before 7, and someone fix the cart in Bay 3. The wheel's been dragging for a week. Labs are already on your screen, Elena said. Uploaded at 6:30. Cart's been submitted to maintenance twice. I can send a 3rd request. Whitmore finally looked at her. It was the look he always gave her, a fraction of a second too long, like he was mildly surprised she could form a complete sentence. Fine, he said, and walked away. Across the station, Dr. Petra Hollis, second-year resident, fast talker, faster to form opinions, caught the exchange and made no effort to hide her expression. She leaned toward the other resident beside her, Nolan Park, and said something behind her hand. Nolan made a sound that was almost a laugh. Elena heard Glacier and kept moving. She had been hearing it for 3 months, ever since she transferred in from a small urgent care clinic in Salida, or so her paperwork said. The name on her file read Elena Cross, RN. Nothing about her application had raised flags. Nothing about her demeanor invited questions. She was quiet, professional, competent in a way that looked ordinary on the surface because she made no effort to advertise otherwise. She didn't flinch at blood. She didn't speed up when things escalated. She didn't raise her voice. That last part was what bothered people most. In an ER, noise was currency. Urgency was performed loudly, decisions announced with authority, status established through how quickly you moved and how much room you took up. Elena Cross took up almost none. She spoke when she had something to say and didn't when she didn't, and in a hospital culture that ran on visible confidence, her silence read as vacancy. Petra had started the nickname sometime in October, and it had caught the way most mean things catch, effortlessly, without needing to be accurate. The Glacier. Slow-moving, cold, emotionally absent. The staff didn't say it to Elena's face, but they didn't try very hard to say it behind her back either. What they didn't notice, what nobody had thought to look for, were the things Elena knew that she shouldn't. The first time it happened was 6 weeks after she arrived. A 38-year-old man came in complaining of what he described as heartburn and fatigue. He was calm, a little embarrassed about making a fuss, insisting he probably just needed antacids. The intake nurse triaged him as non-urgent. He sat in the waiting room with a magazine. Elena passed him twice. On the 3rd pass, she stopped. She stood in the middle of the waiting room and looked at him the way you look at something you recognize but can't immediately name. His color was wrong. Not alarmingly wrong. Not obvious. But there was a grayness around his mouth that had nothing to do with the lighting. His posture was slightly forward-leaning. He'd put the magazine down without reading it. She walked to the desk and said, quietly, to the charge nurse, "The man in seat 14. He needs a 12 lead now. Don't wait for him to ask." The charge nurse, Darnell Osei, looked at her. "He came in as a gastrointestinal complaint." "I know what he came in as." Darnell pulled up the triage notes. "His BP's fine. His O2 is—" "Darnell." She kept her voice even. 12 lead, please." He did it mostly because she'd said please, he admitted later, and because something in the way she'd stood there looking at the man had been slightly unnerving in a way he couldn't explain. The man had a STEMI, the kind that doesn't announce itself until the wall tears. He was in the cath lab within 22 minutes, and the cardiologist said afterward that another hour in that waiting room probably would have killed him. Darnell told the story to 2 other nurses. The 2 other nurses told residents. Word moved the way it always does in hospitals, through break rooms and hallways and text threads, and the version that reached Whitmore was already distorted. The way he heard it, Elena had made a lucky call on an unusual presentation. "Lucky instinct," he told Petra, who nodded in agreement, because that was the easier explanation. Easier than asking what exactly Elena Cross had learned to see. It happened again with the brain bleed. A 51-year-old woman, post-fender bender, cleared by EMS, walking on her own. She'd been brought in as a precaution, no loss of consciousness, GCS 15. She was texting her daughter when Elena walked through the waiting room and stopped at the edge of her peripheral vision. The woman was blinking irregularly. Not rapidly, just slightly off, like a timing mechanism that had slipped by 2 seconds. Her eyes were tracking, but with a lag that was nearly invisible if you weren't looking for it. Elena went to Petra, who was the attending on triage rotation that hour. "Bay 2 patient needs a CT head, possible epidural hematoma." Petra didn't look up from her chart. "She's GCS 15. EMMS cleared her. Her blink reflex has asymmetry and she's showing a focal tracking delay on the left." "I'm sorry, you diagnosed a focal neurological deficit from across a waiting room? I'm asking you to run the scan. I'll note your concern." Petra turned a page. "Thank you, Elena." Elena stood there for a moment. Then she went to Darnell. Darnell, who had already seen the STEMI, pulled the attending physician on record, a third-year resident named Marcus Fenn, who was covering for a sick colleague, and flagged the patient for imaging. The scan showed a small but expanding epidural bleed. The neurosurgeon was called. The woman was in the OR within 40 minutes. After that, Petra stopped dismissing Elena to her face. She just started working around her entirely, routing questions to other nurses, redirecting credit to herself and her colleagues, constructing a version of the ER's story in which Elena's interventions either didn't happen or happened because Petra had eventually ordered the right things. Whitmore, when he heard about the bleed, reviewed the chart, noted that Dr. Fenn had ordered the imaging, and wrote a brief commendation in Fenn's file. Elena's name appeared nowhere. She restocked the supply cart the next morning without mentioning it. There was a version of this story where Elena would have fought back sooner, where she'd have gone to administration, documented everything, built a case. She had thought about it. In the first few weeks, she'd composed 3 separate emails to the department head, typed them out in full, and then deleted them. Not because she was afraid, not because she thought the situation was acceptable, but because she had learned something across the years of her life before this hospital that most of the people around her hadn't, that the loudest response is rarely the most effective one, that sometimes you watch, and you wait, and you let people show you exactly who they are, and then you decide what to do with that information. What she was still deciding was how much of herself she was willing to reveal, and when. The name on her file was Cross because that was her mother's name, and she'd reclaimed it when she left service. The name Vasquez was her father's, and it was the name she'd carried through 9 years of a life that bore almost no resemblance to a fluorescent-lit ER in Denver. She had been 19 when she enlisted, 22 when she made the specialized medic program, 26 when she completed her second rotation in a place she still wasn't permitted to name in most conversations, 31 when she led a forward operating base medical team through a mountain ambush that lasted 11 hours and left her with a scar along her left forearm that she kept covered with her sleeve. She didn't talk about any of it. Not the missions, not the titles she'd earned, not the 16 soldiers who came home because she'd made decisions in the dark with limited supplies and one working field radio. She had come here because she needed something quieter. That was the honest answer, and she'd given it to exactly no one. What she hadn't anticipated was that quiet would be mistaken for empty. By November, the pattern was established enough that Darnell had started quietly routing unusual cases in her direction. Not officially, not in any way that could be tracked on a chart, but in the particular way of someone who had learned to trust a resource without being able to explain why. Elena noticed. She didn't say anything about it. She just showed up to the cases and did what she could within the confines of her title. On a Tuesday, in the third week of November, she was in Bay 6 with a teenager who'd come in presenting with what had been charted as a panic attack. The boy, 16, was breathing fast, pupils large, knees drawn to his chest. "Okay," Elena said, pulling a stool close and sitting down so she was at his eye level. "I'm going to ask you some questions, and I need you to answer them honestly, even if the answers are embarrassing." The boy looked at her. His mother was outside arguing with the intake desk about insurance. "Did you take something?" Elena asked. He hesitated. "At the party, I don't know what it was. Someone said it was Molly, but I don't." "How long ago?" "Like 4 hours." "Are your teeth clenched right now?" He opened his mouth slightly. His jaw was working. "Yeah." "Are you hot? Like unusually hot, even though it's cold in here?" "Yeah." "Okay." She reached over and pressed 2 fingers against his wrist, counted. Then she straightened. "You have serotonin syndrome from a contaminated stimulant, not a panic attack. I need you to stay as calm as you can while I get the right medication." She was out of the bay before he could answer. She found the charge physician on duty, not Whitmore, thankfully, but a quieter attending named Dr. Luz Harmon, and gave her the summary in under 90 seconds. Harmon ordered the cyproheptadine. The boy's temperature had peaked at 104. He came down over the next 2 hours. His mother found Elena in the hallway afterward and grabbed her hand with both of hers and didn't say anything, just pressed. Elena nodded once and went back to the supply cart. 2 hours later, Petra had apparently gotten wind of the case and appeared at the nurse's station with her arms crossed. "I hear you diagnosed a tox case." "I flagged a presentation for Dr. Harmon," Elena said. "You're an RN, Elena. You triage and assist. You don't diagnose. I know what my role is." "Do you?" Petra tilted her head. "Because you've got a habit of overstepping, and at some point that becomes a liability. For you. I'm just saying." Elena looked at her for a moment. "The boy is stable. His temperature's down. Dr. Harmon made all the clinical calls." "Right." Petra pushed off the desk. "Just keep your lane. That's all." She walked away. Elena watched her go, then turned back to the cart. "Keep your lane." She thought about the last time someone had told her to keep her lane. It had been a colonel, in a tent, in the dark, with 3 men bleeding on the floor and a 4th screaming. She had told the colonel that his approach would kill patient 2, and he had told her to know her role, and she had done the procedure anyway, and patient 2 had survived and the colonel had written her up, and then, 6 months later, when the full picture became clear, had requested her for his next deployment. She had not reminded him of the conversation. She did not remind Petra of anything either. December brought a cold front and a week of high-volume nights. Flu, ice accidents, 2 kitchen fires in the same apartment complex 2 days apart. The ER was running hot, short-staffed, and short-tempered. Whitmore was in surgery more than he was on the floor, which meant Petra had expanded into the authority vacuum with the enthusiasm of someone who had been waiting for exactly this opportunity. She reorganized the nursing assignments without consulting the charge nurse. She started signing off on supply orders that weren't in her scope. She wrote up a junior nurse named Kate Brewer for an intake error that Petra had arguably caused by changing the protocol 2 days earlier without telling anyone. Elena watched all of this. She also noticed that same week that Whitmore had presented a case summary at the department meeting that included Elena's assessment of the brain bleed patient, reframed as his own clinical thinking. He'd cited the imaging decision as evidence of his diagnostic approach. He'd used the word intuited. Darnell had been in the room. He'd found Elena at the coffee machine afterward and stood next to her without saying anything for a full 30 seconds. I heard, she said. You gonna do something about it? Eventually, he exhaled through his nose. That's a very calm answer for what just happened. I've been calm about worse things. He looked at her sideways. I believe you, he said, and he sounded like he meant it in a way that was larger than the specific conversation they were having. It was the second week of December when Whitmore finally made a move that wasn't about stealing credit or strategic ignorance. He called her into his office. It was a small office, the kind that accumulates paper and coffee cups, and the ghost of 10,000 administrative decisions. He had her file open on his desk, which surprised her. She hadn't thought he knew enough about her to have a file worth opening. Sit down, he said. She sat. I've been reviewing the nursing staff performance assessments, he began, with the particular tone of a man who had already decided the outcome of the conversation and was now narrating the path toward it. And I have some concerns about your clinical judgment calls. Which ones? He shifted. Several cases over the past 3 months where you flagged presentations ahead of the ordering physician. And the patients? That's not, were the flags accurate? A pause. In some cases, yes. But Elena, the issue isn't accuracy. It's the chain of command. When you root around attending physicians, you create confusion, you create liability, and you undermine the structure that keeps this department functioning. She held his gaze. I understand. Good. He folded his hands. I'm putting a note in your file. It's not a formal warning yet, but it will be if this continues. I need you to route all clinical observations through the attending on duty before taking any action, even if you think it's urgent. Elena looked at him. She thought about the STEMI patient in seat 14, the woman with the epidural bleed, the boy with the temperature of 104. She thought about what waiting for the attending would have meant in each of those moments measured in minutes. I understand, she said again. That's all. She stood. She was almost at the door when he said, without looking up from his desk, You're a competent nurse, Elena. I'm not saying otherwise, but competent nurses work within the system. She stopped. She didn't turn around. Yes, sir, she said, and she left. Outside in the hallway, she breathed once through her nose and let the anger move through her the way she'd trained herself to let things move, fully, quickly, without snagging. Then she pulled out her phone and sent Darnell a message that said simply, Bay 3 cartwheel is still broken. Can you escalate to facilities directly? Because the cart needed fixing, and she was still here, and there was still work to do. Well, 3 days later, Whitmore told her she was being moved to the day shift overflow team, effectively a demotion, though no one used that word. The overflow team handled lower acuity cases, rerouted patients during surge periods, and spent significant portions of their shifts managing paperwork. It was where they put nurses they didn't want to fire but didn't want making decisions either. Petra, passing in the hallway, made no effort to conceal her satisfaction. Kate Brewer found Elena in the locker room afterward, eyes red, voice tight. That's not fair. Everybody knows that's not fair. It happens, Elena said. You saved 3 people in the last month. Nobody's tracking it that way. Kate sat down on the bench. Doesn't it bother you? Elena thought about that honestly. Yes, she said. But being bothered doesn't change the situation. Then what does? Elena zipped her bag. Time, she said, or a situation that forces the truth out faster than people expect. She didn't know, when she said it, that the situation was 11 days away. The morning of December 23rd arrived gray and cold, the kind of cold that gets into joints and makes everything feel provisional. Elena came in at 6, completed her handoff from the overnight overflow nurse, and started her rounds. The ER was moderately busy. 2 post-holiday party alcohol cases, a compound fracture from a black ice fall, the usual December respiratory presentations. She was at the supply cart at 6:44 when the radio crackled. The hospital's emergency communications system, a relic that had somehow survived 4 rounds of tech updates, broadcast through ceiling-mounted speakers when activated by incoming emergency services. It was mostly used by paramedics calling ahead on trauma runs, occasionally by fire or police coordinating patient transfers. It was not, in anyone's recent memory, used by military aircraft. The voice came through with the particular static of a high-frequency radio channel, compressed, slightly flattened, unmistakably authoritative. Riverside Haven Medical, this is Flight Surgeon Captain Darrow, 10th Special Forces Aviation Regiment. Confirm Commander Vasquez is on premises. We have 3 critical inbounds with complex trauma. ETA 11 minutes. We need her on that floor. The ER went quiet. It didn't go quiet gradually, the way sounds sometimes fade. It went quiet all at once. The monitor beeps continued, the HVAC hummed, but every human noise in the room simply stopped. Conversations mid-word, the scratching of a pen, a resident's coffee cup paused halfway to her mouth. 30 people looked at the ceiling speaker. Then 30 people looked at each other. Then, in the particular way that a crowd locates the most likely target for a piece of information, following the logic of the moment even before the logic was explicit, 30 people turned toward the quiet nurse standing by the supply cart. Elena had set down her clipboard. Her eyes were closed. Just for a second. Just long enough to make the calculation. Then she opened them, and she reached for the wall-mounted intercom panel next to the supply cart, and she pressed the transmit button, and she said, in a voice that no one in that ER had ever heard her use before, steady, flat, carrying an authority that had nothing to do with volume. Captain Darrow, this is Commander Vasquez. Confirm presence. What are we dealing with? The silence in the room somehow deepened. Captain Darrow's voice came back without hesitation. Vehicle rollover on Route 9 involving a military transport. 3 casualties, 2 adult males, 1 child. Pediatric patient critical. Head, chest, and abdominal injuries. She's been intubated, but she's fighting it. We've done what we can, but she needs a surgical suite, and she needs it now. Understood, Elena said. What's her pressure? 70/40 and dropping. Breath sounds? Diminished on the left. She was already moving. Get me Harmon and a surgical consult. Bay 1, clear it now. I need a chest tray, 2 large-bore IVs, and someone call pediatric surgery. She looked at Darnell, who was already 3 steps ahead of her, phone to his ear. And someone tell the incoming flight surgeon I'll be at the bay door. She was at the supply cart, pulling equipment, when she became aware that nobody else was moving. She turned around. Whitmore was standing in the middle of the ER floor. He was looking at her with an expression she hadn't seen on his face before. Not authority, not dismissal. Something more unsteady than either of those. Elena, he started. Dr. Whitmore. Her voice was not unkind, but it left no space. There is a child with a tension pneumothorax 11 minutes out. I need that surgical suite, and I need this team moving. Whatever else we need to discuss, we can discuss after. A beat. He nodded, and the ER came back to life around her. Faster than it had moved in months, louder than it needed to be, with an energy that was partly adrenaline and partly something else. Something that happens when people suddenly understand that the person they dismissed was never what they thought she was. Elena didn't watch any of that. She was already heading for the bay doors, pulling on gloves, running the child's vitals in her head against every chest trauma protocol she'd ever used in conditions far worse than this. The helicopter was 8 minutes out. The girl was dying, and Commander Vasquez, whoever she had been pretending not to be, was done pretending. The bay doors were the old kind, the ones that didn't open automatically but had to be pushed, and Elena hit them with her forearm without breaking stride. The cold outside was immediate and physical, that particular Denver December cold that doesn't ease into you but arrives all at once, pressing against exposed skin like a flat hand. The helipad was 40 feet from the bay entrance, across a stretch of painted concrete that was showing frost at the edges. Elena crossed it in 15 seconds, gloves on, eyes already tracking the sky to the northwest where the navigation lights of the helicopter were moving fast against the gray. Behind her, she could hear the ER reorganizing itself. Darnell's voice carrying instructions, the clatter of the chest tray being wheeled into position. Someone, Kate, she thought, from the pitch, calling the elevator for the surgical floor. The sounds of a team that had abruptly remembered what urgency actually looked like. She stood at the edge of the helipad and watched the helicopter come in. It was a military transport modified for medical evacuation. Not the sleek, civilian-configured air ambulances she'd seen working Denver, but something with more structural bulk, painted in the flat, dark colors of a unit that didn't advertise itself. The rotors threw cold air in all directions as it descended, and Elena turned her face slightly to keep her eyes clear. She'd stood on hundreds of landing pads. She'd stood on dirt fields and gravel lots, and the roofs of buildings that probably shouldn't have been used as landing pads. The noise and the wind were familiar in a way that bypassed her brain and went straight into her body. The skids touched down. The side door opened before the rotors had fully cycled down, the way it does when the people inside have been watching seconds like currency. The flight surgeon, Captain Darrow, was the first one out. Mid-30s, sharp-faced, wearing a flight suit with a medical cross patch on the sleeve. He moved toward Elena with the ground-eating stride of someone used to covering distance fast, and he extended his hand while he was still 3 steps away. "Commander?" The word landed with absolute certainty. No hesitation, no qualification. He hadn't seen her in a year and a half, and he addressed her by title the way you'd address the North Star, as a fixed point, not a greeting. "Darrow," she took his hand briefly. "Tell me everything." He was already turning back toward the helicopter, talking as he moved. Pediatric patient, female, approximate age 7 to 9. Transport vehicle lost traction on Route 9 northbound, went through a guardrail, fell approximately 30 feet. She was in a rear-facing booster, may have saved her life or compounded the chest injury, we don't know. GCS dropped from 12 to 8 during transport. We intubated at the scene, but left side breath sounds are inconsistent and deteriorating. "Tension pneumo," Elena said. "That's my read, too. Couldn't needle her in the air. Too much movement, visibility was poor, she was fighting the tube. Pressure still 70/40? Was when we called. Could be lower now." They reached the helicopter door and, inside, a medic, young, maybe 25, with dried blood on his wrist from where he'd clearly been working, was managing the bag valve mask with one hand and holding traction on an IV line with the other. Behind him, strapped to the narrow transport litter, was a child. She was small. That was the first thing. Small the way children look when they're hurt and unconscious, compacted into themselves, all the ordinary animation of a kid completely absent, leaving something that looked fragile in a way that made Elena's chest do something she didn't let show on her face. The girl's face was scraped on the left side, hair matted with dried blood near the temple. The ET tube was secured with tape that had partially lifted in the cold. Her chest was moving, but the left side had a quality to its movement, a subtle wrongness, a flatness on the inhale, that Elena clocked in under 2 seconds. "Get her out," Elena said. "Carefully. Support the head." The medic looked up. His eyes went to Elena and then to Darrow with a question in them. "You heard her," Darrow said. They moved the girl in 60 seconds. Elena walked alongside the litter with her hand on the ET tube the entire way, keeping it stable, because a displaced airway in a pediatric patient with compromised respiratory function was the fastest available path to a very bad outcome. The medic kept the IV line clear. Darrow held the door. Inside Bay 1, the team was assembled with varying degrees of composure. Harmon was there. Dr. Luz Harmon, the attending Elena trusted most in this building, now standing at the head of the bay with her arms crossed and her eyes moving over the incoming patient with the professional calm of someone running calculations you can't see. She was 51, had done 2 years at a trauma center in Baltimore before moving west, and she had the particular stillness of a physician who had stopped needing to perform competence for an audience. Petra was also there. No one had technically invited her, but she'd appeared and she'd positioned herself near the medication cart with an expression that was trying to be clinical and landing somewhere between that and rattled. Whitmore stood back. Not far back, he was still in the bay, but far enough that he wasn't claiming the center of the room. Elena noticed this without looking directly at him. They got the girl onto the bay bed. Elena came around the left side while Harmon came from the right, and for a moment they worked in parallel. Elena's hands on the chest, Harmon's on the airway, assessing without speaking because there wasn't time to speak, and they both knew it. "Breath sounds," Harmon said. "Absent on the left. Tracheal deviation beginning. I can feel it." Elena straightened. She needs needle decompression now and a chest tube within the next 10 minutes. If we don't release that pressure, she's going to arrest. Agreed. Harmon turned. Who's got the chest tray? Kate was there with it already open. Darnell was drawing up the lidocaine. Petra said, "Shouldn't we wait for imaging to confirm?" "There's no time for imaging," Elena said. She didn't say it loudly. She said it the way she said most things, with an evenness that had nothing to do with emotion and everything to do with clarity. Her trachea is shifting. Her pressure is sub 80. If we wait for a scan, she's going to code on that table. Petra opened her mouth. Harmon said, "Elena's right. Let's go." Elena prepped the site. Second intercostal space, mid-clavicular line, left side, while Darnell pushed the lidocaine through and Harmon managed the airway. The room compressed itself around the task. Outside sounds became irrelevant. Time didn't slow down the way people in movies claim it does. It just reorganized itself around the next necessary action. She inserted the needle. The rush of air was immediate and audible in a room that had gone as quiet as a room full of people can get. The girl's chest wall relaxed on the left side, with the particular give of pressure being released from a space that had been building toward catastrophe. Her oxygen saturation, 47 seconds of everyone in the room watching that number, climbed from 81 to 89 in the next minute. Nobody cheered. That's not what happens in actual trauma bays. What happened was that Harmon exhaled through her nose. Darnell said, "SAT's coming up," in a tone that was professional and also deeply relieved, and the medic from the helicopter, standing in the doorway where no one had told him to go, pressed the back of his hand to his mouth briefly and then straightened up. "We need that chest tube in the next 8 minutes, Elena said. "And I want pediatric surgery down here." "Where are we on that?" "On their way," Kate said. 5 minutes out." "We don't have 5 minutes for the tube, Dr. Harmon." "I'll place it." Harmon was already reaching for gloves. "Talk me through her weight estimate. I want dosing on the sedative adjusted." 24 kilos, Elena said, without hesitating. Harmon looked at her over the table. A look that lasted exactly 1 second and contained a very specific question. "She's small for her age," Elena said. "Bone structure, estimation from field work." Harmon nodded and turned to the medication chart. From somewhere behind her, Elena heard Whitmore say very quietly, to no one in particular, "How does she know that?" Nobody answered him. The chest tube took 9 minutes. It should have taken 12, but Harmon was good and the setup was clean and the girl was small, which helped and hurt in equal measure. By the time pediatric surgery arrived, 2 of them, Dr. Reyes and a fellow named Stockton, the tube was in and draining and the girl's pressure had crawled back up to 91/60. Not safe, but survivable for the next few minutes, which was all they needed. Dr. Reyes, compact, silver-haired, with the kind of flat-vowel directness that came from 2 decades of pediatric trauma, reviewed the status in under 30 seconds and said, "She needs the OR now." Then she looked at Elena. "You placed the needle decompression?" "Yes." "Good call. Any abdominal involvement we know of?" "Mechanism suggests possible splenic injury. Her abdomen was guarded on the left when she came in." "I see it." Reyes was already moving toward the phone. "We're taking her up. Good work." It was 2 words. Good work. In the context of that room, in that moment, it carried about 10 times its weight. Elena turned away before her expression could do anything she hadn't authorized. That was when she became aware of how many people were still in the bay. The room had not cleared the way it normally does when a patient moves to surgery. The helicopter medic was still in the doorway. Darrow was standing near the wall with his arms crossed, watching Elena with an expression that was impossible to read quickly. Darnell was at the monitoring station, but he wasn't looking at the monitor. Kate was holding an empty tray with both hands. Petra was backed against the medication cart with her arms at her sides. And Whitmore was in the center of the bay with his hands in his coat pockets and the expression of a man who has walked into a room and found that the room is significantly different from what he had understood it to be. The litter went past him. He watched it go. Then he looked at Elena. "Vasquez," he said, like he was testing the word. "Cross," she said. "Here." He blinked. "Those are 2 different names." "They're both mine." She stripped off her gloves and dropped them in the waste container. I need to debrief with Captain Darrow. Is there something that needs to happen in the next 10 minutes, or can it wait? A long pause. It can wait, he said. She and Darrow took the family consultation room down the hall from the bay, a small room with 4 chairs and a window overlooking the parking structure, furnished with the particular cheerlessness of a space designed to deliver bad news. Darrow sat. Elena remained standing for a moment, then sat too, because she was tired and her leg had been aching since the cold on the helipad, and she was done pretending it wasn't. "How'd you end up here?" Darrow asked. Not accusatory, genuinely curious. "Transfer about 3 months ago?" She didn't elaborate. "Voluntary?" "Yes." He accepted that. "Burnout or something else?" "Something else." She looked at the window. "I needed to be somewhere quieter for a while." "And was it? Quiet?" She almost smiled. "Not especially." He watched her for a moment. "The unit sends their regards. Holt asked about you specifically. Said to tell you the thing with the river crossing worked out the way you said it would." She didn't ask which river crossing. She remembered them all. "Give Holt my best," she said. Darrow leaned forward with his elbows on his knees. "I have to ask. The kid, the girl, you were very certain about the tension pneumo. Your pressure estimate on placement was, I've placed a lot of tubes in worse conditions. I know that, but the staff here," he paused, "they didn't seem to know that." Silence. "No," Elena said. "They didn't." He studied her. "You let them think you were just a nurse." "I am just a nurse." "Elena." "Darrow." She looked at him directly. "I'm still figuring out how much of what I was before is something I want to be again, and that's mine to figure out, okay?" He held up a hand. "Okay, I hear you." A beat. "For what it's worth, the way that bay organized itself when you walked in. That wasn't a hospital doing what hospitals do. That was people responding to something they didn't have words for yet." She didn't answer that. "The girl's parents," she said instead. "Were they in the vehicle?" Darrow's expression shifted. "Father was driving. He's in surgery. It's femur fracture and a head laceration that's being evaluated. Mother wasn't in the transport. We've notified next of kin. Someone should be with the girl when she comes out of surgery. She's going to wake up confused and scared, and she'll want a face she knows. Social work is on it." "Good." Elena stood. "I need to check back on the other 2 patients from your transport. Adult males, both stable. Captain Renner has a broken radius and contusions. Sergeant Oyalaran has 3 cracked ribs and a mild concussion. They're both asking about the girl." "I'll update them." She was at the door when Darrow said, "The unit would take you back. If you ever—" "I'm not pushing. I'm just saying it. The slot's held." She kept her hand on the door frame. "I know," she said. "Thank you." She meant it. She also didn't turn around. The adult patients were in bays 4 and 6. Captain Renner was a broad-faced man in his late 30s with a radius fracture that had been splinted and a knot above his left eyebrow that was going to be spectacular in about 12 hours. He was sitting up when Elena came in, which was already more than he should have been doing, and he stopped mid-sentence. He'd been talking to a nurse about his phone, wanting it back, when he saw her. "Commander!" He moved to stand up. "Don't," she said. "Stay down. You've got a fracture and a probable concussion." "Yes, Commander." She pulled the chart, checked the splint, verified the neuroassessment. She did it quickly and completely, the way she did everything, and she spoke to him in the efficient shorthand she hadn't used in 3 months. Specific, direct, no softening at the edges. He answered the same way. "The girl," he said, when she'd finished reviewing his chart. "In surgery. Dr. Reyes is excellent. She's got the best chance she could have right now." "She got a name? The kid?" Elena checked the intake form. "Parker. Lily Parker." He absorbed that. "She was in the seat behind me. When we went through the rail..." He stopped. "I keep hearing it." "That's going to happen for a while," Elena said. It's not a weakness. It's what happens when something like that occurs and you were present." He looked at her. "You always say that." "Because it's true. You always say that too." A pause. The staff here. They didn't know. No. Does it bother you that they didn't? She thought about the supply cart, the 3 emails she'd deleted, the note in her file, Whitmore's face in the bay. Yes, she said, because he'd asked honestly and he'd earned an honest answer. But I made choices that contributed to it, so it's not uncomplicated. He nodded slowly. You always were the most annoyingly self-aware person in the unit. You're going to need an orthopedic consult, she said. I'll make sure that's scheduled before I leave your bay. He almost smiled. Yes, Commander. Sergeant Oylerin in Bay 6 was a different kind of patient. Quieter, more internal. The kind of person who processes pain by going somewhere private in his own head. He was lying flat with a blood pressure cuff still on his arm, staring at the ceiling, and he turned his head when Elena came in without showing surprise. How's the kid? He said, before she could say anything. In surgery. Good hands. He looked back at the ceiling. She was awake when we pulled up. Right after impact, she said... He stopped. She said she was cold. Elena said nothing. Is that bad? That she said she was cold? It means she was conscious. It means she was communicating. Those are things that matter. Yeah. He was quiet for a moment. Darrow said you'd be here. I didn't believe him. Why not? Because last I heard you were somewhere else entirely, and you don't usually end up in places that look like this. The circumstances were specific, Elena said. He looked at her. The people here. Do they know what you did? Out there. What it actually... Let me check your rib assessment, she said. He accepted that. He'd learned, same as the others, when the conversation was over. She checked his chart, confirmed the imaging, reviewed the analgesia protocol, and decided it was adequate. She noted a slight concern about his respiratory effort. With 3 cracked ribs, restricted breathing could compound over time. And she added a notation for the attending to monitor and consider incentive spirometry. When she was done, he said, For the record, I'm glad you were here. Take your pain medication on schedule, she said. Don't try to breath through it. Tell the nurse if it gets worse. Elena, she looked at him. I'm glad you were here, he said again. She held that for a moment. Me too, she said, and she meant it in at least 3 directions at once. Whitmore found her in the hallway outside Bay 6. He'd clearly been waiting. He was positioned in a way that blocked natural foot traffic without looking like he intended to, which was a particular skill of people who wanted to intercept without appearing confrontational. She stopped. I need to understand what I'm looking at, he said. The bluster was gone. What was left was more honest, and she had to admit more difficult to work with, because she could dismiss bluster, but she couldn't dismiss a person genuinely trying to reckon with something. What specifically? She said. The name, the title, He gestured vaguely toward the room where Darrow was still presumably sitting. That pilot addressed you as a commander in the Special Forces. Special Operations Medical Corps, she said. Commander was the field designation. The rank is different. How long? 9 years. He stood there with that. She watched him add it to the math of the last 3 months. The STEMI, the brain bleed, the serotonin case, the note in her file, the demotion to overflow, and she watched the arithmetic change his face. You never said, you never asked. She kept her voice neutral. And there was no requirement that I disclose it. You let me put a note in your file. You made a decision based on the information you had and the assumptions you were already carrying, she said. I can be frustrated about those assumptions without pretending I did nothing to enable them. He blinked. He paused. That's a very even response to what I did. I've had some time to think about it. He looked away for a moment. The cases you flagged, the STEMI, the bleed, Harmon and Darnell, and Dr. Fenn made all the documented clinical decisions, she said, because that was accurate and because she needed it, said clearly. But you saw it first. Yes, every time. Most times, she corrected. I've been wrong before. Less often than average, but I've been wrong. He absorbed that too. Then he said, I owe you an apology. You owe me more than one, she said. Not unkindly, not with heat, just accurately. He nodded, once, slowly, the way a person nods when they've received information they deserved and aren't going to dispute. When this is finished, when we know the girl is out of surgery, I'd like to talk properly. About the note, about the transfer to overflow, about... His pager went off. Both their pagers went off. Then the overhead intercom, which never announced good news. Trauma team to OR3, pediatric surgical emergency. All available trauma personnel. Elena was already moving. She heard Whitmore behind her, matching her pace, his longer stride cutting the distance in the hallway. Around the corner, Darrow emerged from the consultation room at a run, catching the urgency from the air itself. "What happened?" Darrow called. Elena hit the stairwell door. "Lily Parker," she said, "is not out of surgery." She took the stairs 2 at a time, which was harder than it used to be, and she did it anyway, and she was already running the possible complications in her head: bleeding, hemodynamic instability, the splenic injury she'd noted on intake, when she pushed through the door to the surgical floor and nearly collided with Dr. Reyes coming the other way at speed. Reyes caught her arm. Her face was tight in a way that made Elena's stomach drop. "She's crashing," Reyes said. "Internal bleeding we didn't catch on initial imaging. The spleen is worse than it looked, and she's got a hepatic laceration. BP's at 58. We're losing her." Elena held Reyes's gaze for exactly 1 second. "What do you need?" she said. Reyes looked at her, the question landing, being answered somewhere behind her eyes. "Tell me you've done hepatic damage control in the field." The hallway was very quiet. "Yes," Elena said. "Then get in there," Reyes said, and she turned and ran, and Elena ran after her, and the surgical suite door swung open ahead of them, and inside the monitors were screaming in the particular way that means a small body is running out of time. The surgical suite was cold the way operating rooms always are. A deliberate, institutional cold that has nothing to do with comfort and everything to do with infection control and keeping surgeons functional under lights that generate more heat than most people realize. Elena felt it hit her face when the door opened, and she followed Reyes through without breaking stride. The room was already organized into the particular controlled chaos of a surgery going wrong. 2 scrub techs repositioning instruments, an anesthesiologist at the head of the table making rapid adjustments to the drip lines, a circulating nurse calling out pressure readings in a flat voice that was doing its professional best to stay flat. Stockton, the fellow, was at the table with his hands in the field and his eyes doing the thing eyes do when the thing they're looking at is worse than expected. Lily Parker was a very small person surrounded by very large machinery, and the monitors above her were producing numbers that made Elena move faster. "BP 54 and falling," the circulating nurse said. "I need 2 units ONEG running now," Reyes said, pulling on her second glove as she crossed to the table. "What's her temp?" 95.2. "She's hypothermic on top of everything else." Reyes looked at Elena. "Scrub in. There's a gown on the back table." Elena was already moving toward it. The scrub tech, a woman named Adeze, according to her badge, who had the practiced economy of motion that came from years in surgical suites, helped her without being asked, moving efficiently, tying off without fumbling. Elena was gloved and positioned at the table in under 90 seconds. What she saw in the field was not good. The hepatic laceration was a grade 3. A deep tear in the right lobe that had been bleeding slowly enough to evade the initial imaging assessment and fast enough to become a crisis the moment surgical manipulation had shifted the surrounding tissue. The spleen was worse, shattered at the inferior pole, actively bleeding despite the packing Stockton had placed. "She can't sustain a splenectomy at this pressure," Elena said. "I know," Reyes said. "Her coagulation's going to fail before we get control of the liver." "I know." Reyes met her eyes across the table. "Tell me what you've done in the field with this presentation." Elena looked at the field. She ran the variables: temperature, pressure, active bleeding from 2 sites, a pediatric patient with less blood volume to spend than an adult, coagulation factors that were already being consumed faster than they could be replaced. She had done this calculation before. She had done it in worse lighting with less equipment and no surgical fellow standing across from her. "Damage control sequencing," she said. "Pack the liver, don't chase the spleen yet. Get her pressure up before we do anything definitive. If we try to repair while she's this hypotensive, we're going to lose the field and her both. Reyes nodded once. Stockton, hold what you've got. We're shifting to damage control. Elena, I need you on the hepatic packing. Apply direct pressure, two-hand technique, and don't let up until I tell you. Understood. She placed her hands into the field the way she had placed hands into fields in tents and helicopter cabins, and one memorable occasion in the back of an armored vehicle, with the particular focus of a person who has learned to make their hands into tools and keep the rest of themselves somewhere adjacent to the immediate horror of the situation without leaving entirely. The bleeding slowed. Not stopped. Slowed. Pressure? Reyes asked. 58, the circulating nurse said, then 61. She's buying us time, Stockton said, and he sounded slightly astonished. Don't celebrate, Elena said. Get the warming blanket on her legs. We need her temp up. Already on it, Adeyezi said from behind her. The next 20 minutes were the kind of 20 minutes that don't feel like 20 minutes. They feel like a compressed, airless space in which everything that exists is the field and the numbers and the next decision. The anesthesiologist, Dr. Vance, whose voice Elena had been hearing as a steady background presence since she entered the room, called pressure updates every 90 seconds, and Elena learned the rhythm of those calls the way you learn any rhythm under stress, not consciously, but in your body, so that a deviation from it would register as alarm before your brain caught up. 61, 67, 64. A dip that made Elena press harder and made Reyes say something under her breath that wasn't a word exactly. Then 69, 72. We're getting there, Reyes said. We need to address the spleen before we close, Elena said. But not until she's above 80. Agreed. Can you hold position? Yes. She held position. Her arms ached from the angle. The table height was calibrated for Reyes and Stockton, and Elena was half an inch shorter, which put her at a slight extension she wouldn't have chosen. She noted the discomfort and set it aside. She had held positions in worse angles for longer periods. This was manageable. What was less manageable was the sound of the monitors. Not because they were alarming, they were improving incrementally, the way things improve when you've made the right call and the patient's body has not yet decided to give up. But because every number was also a reminder of how small the margin was. A child's blood volume is not a forgiving system. There was no room for a second crisis. She thought about Lily saying she was cold. She kept her hands exactly where they were. At the 74-minute mark, she knew because Vance had been calling time intervals since the second unit of blood went up. Lily's pressure stabilized at 83/55 and held there for 4 consecutive readings. Okay, Reyes said. Let's address the spleen. Elena, I'm going to need you to transition from packing to suction as I work. Talk me through what you see. What followed was the kind of surgical collaboration that doesn't have a formal name, but happens when two people with different training encounter the same problem and discover that their approaches are complementary rather than competitive. Reyes worked with the precision of a pediatric surgeon who had spent 20 years developing technique. Elena worked with the practical adaptability of someone who had learned to solve the same categories of problems without surgical suites. They didn't always agree on the order of operations, and twice Elena said something that caused Reyes to pause and reconsider, and once Reyes overruled Elena's instinct and was correct to do so. The spleen came out in 31 minutes. It was not elegant, it was functional. Lap count, Reyes called. All accounted for, Adeyezi said. Irrigate and let's close. Vance, where are we? BP 89/60 and climbing. Temp is up to 96.8. She's fighting. Good. Reyes looked up at Elena. Good call on the damage control sequencing. You would have gotten there, Elena said. Maybe. But maybe 30 seconds later, and I don't want to think about what 30 seconds looks like in this field. Elena stepped back from the table. The scrub tech moved in to assist with closure. Elena stripped her outer gloves, the inner pair was still intact, and became aware for the first time in over an hour that her legs were tired and her left arm was trembling slightly from sustained extension, and she was very, very thirsty. She also became aware that Stockton was staring at her. He had been quiet for most of the procedure, focused, competent, doing what was asked of him without commentary. Now he was looking at her the way people look at things they don't have an immediate category for. Where did you train? He said. She pulled off her gown. Here and there. That's not an answer. No, she agreed. It's not. She left the OR before he could form a follow-up. Outside the surgical suite, in the corridor that smelled like antiseptic, and the particular stillness of a floor that is always either very busy or completely quiet, with nothing in between, she found Darrow leaning against the wall with his arms crossed, and an expression that suggested he had been standing there long enough to get updates from the OR intercom, but not long enough to stop worrying. He looked at her face and read it correctly. She's okay. She's stable. Reyes is closing now. He exhaled. The father? Still in surgery for the femur, last I knew. I'll check. Darrow pushed off the wall. Elena, you know what happened in there is going to come out. I know. The hospital, the staff, they're going to want to know. They already want to know, she said. They've been wanting to know since 6:47 this morning. He looked at her steadily. Is that going to be a problem for you? She thought about the 3 deleted emails, the note in her file, Whitmore's face when he said Vasquez like he was testing a word he'd never spoken before. Petra's keep your lane, the supply cart she'd restocked every morning for 3 months, carefully, completely, as if it were the only thing she was qualified to do. I don't know yet, she said honestly. Darrow nodded. He didn't push it. That was one of the things she had always respected about him. He understood the difference between information he was owed and information that wasn't his. Captain Renner's asking about the girl, he said. Tell him she's stable. Tell him she's going to wake up. A pause. Tell him it matters that he asked. Darrow looked at her for a moment. Yeah, he said. I will. She found a bathroom at the end of the corridor and ran cold water over her wrists the way she'd learned to do years ago when she needed to bring her temperature and her nervous system down from whatever height they'd climbed to. She looked at herself in the mirror for a few seconds, not evaluatively, just as a check-in, the kind of thing you do to confirm that you are still a continuous person and not a collection of separate moments strung together by exhaustion. She looked tired. Her left arm had a faint tremor that was already fading. There was a dried blood smear on the back of her right hand where the outer glove had a small defect she'd noticed but not had time to address. She washed her hands thoroughly and went back out. The surgical floor was filling up slightly. A shift change was due in 90 minutes, and some of the incoming staff were already present, moving through the floor, pausing at the station outside OR3 to ask questions of the charge nurse about what had happened and who the woman in scrubs was who'd scrubbed in with Reyes. Elena heard her name twice in 20 feet and kept walking. She took the stairs back down to the ER. The stairs were quieter than the elevator, and she needed a few more seconds before she walked back into whatever was waiting for her there. What was waiting for her there was more than she'd estimated. The ER had not resumed normal operations. That was the first thing she noticed. The rhythmic functioning of a busy emergency department, which normally reasserted itself within minutes of a crisis, because that was the nature of the place and the people who worked in it, had not reasserted itself. The floor had a strange, suspended quality, like a room where someone has just said something that everyone is still deciding how to respond to. Darnell was at the central station, and he looked up when she came through the door with an expression she'd seen on him before. Not quite relief, not quite something else, but an adjacent thing that was doing double duty for both. The girl? He said immediately. Stable. Out of OR within the hour. He put his pen down flat on the desk. Okay, he said, in the voice of someone who has been holding something for a while and just set it down. Okay, good. Around the station, other staff had oriented toward her in the way the room had reoriented that morning when Darrow's call came through. Not all at once this time, but in the particular gradual convergence of people who have questions they don't quite know how to start. Kate was there, still on shift, despite being 40 minutes past the end of it. She had her jacket on but hadn't left. She looked at Elena and seemed to decide something, and then simply said, "Is there anything you need right now?" It was such a plain question that Elena almost didn't know what to do with it. "Coffee," she said, "and the status on the father. Marcus Parker." Femur fracture, OR 2 or 3. I'll get both, Kate said, and moved. Petra was not at the station. Elena noted the absence without assigning it a meaning yet. Whitmore was at the edge of the floor near the physician's office, speaking with someone Elena didn't recognize. An administrator, from the look of the badge, the particular dress code neutral outfit of someone who worked on a floor with carpeting. They were speaking in low voices, and Whitmore's posture had the tightness of a person in the middle of a conversation he hadn't wanted to be in. He saw Elena. He said something to the administrator, who looked at Elena, and then he came across the floor toward her. "She's stable," he said. "Out of OR within the hour. Reyes will update the family." He exhaled. Then he said, "I told administration what happened this morning. All of it. The call, the bay, the OR." She looked at him. "All of it?" "Yes." He held her gaze, which she could tell cost him something. "They're going to want to speak with you." "About what specifically?" "Your credentials, your background, the scope of what happened in that OR." He paused. "I want to be direct with you. This could go several ways administratively, and I don't want to pretend I know how, but I told them the accurate version, not a version that protected me." She studied him. "Why?" He blinked slightly, like the question surprised him, then recognized it was a fair one. "Because what I did this fall, the file note, the transfer to overflow, all of it, was based on a set of assumptions about who you were that were completely wrong, and those assumptions caused real harm. Not to the patients, because you compensated for my mistakes, but to you." He stopped. "I'd like to fix that, if it's possible to fix it." The ER moved around them. A paramedic crew came through the bay doors with a gurney, and someone called out a triage level, and the normal machinery of the place engaged around the edges of the conversation. Elena said, "Can the administrator wait until after I know the Parker girl is out of recovery?" "I'll make sure of it," he said. She nodded. She didn't say thank you, and she didn't say I forgive you, because neither of those things was exactly true yet, and she had never been good at saying things that weren't exactly true. Kate came back with coffee that was bad in the particular way of hospital coffee, which Elena drank in its entirety because the alternative was nothing, and the status on Marcus Parker, who was out of surgery and in recovery with his femur repaired, and a neurology consult pending for the head laceration, but no findings yet that suggested significant intracranial involvement. Elena relayed this to Darrow, who relayed it to Renner and Oylarin. She was standing at the station reviewing Lily's updated transfer chart. The girl would move to the pediatric ICU once Reyes cleared her, which should be within 2 hours, when she heard the voice. She heard it before she turned around. She heard the particular register of it, the precise combination of pitch and projection that she had learned to identify the way you learn to identify weather. Petra Hollis had not left the building. She had, it appeared, been in the physician's lounge. She was coming out now with her coat over her arm and her bag on her shoulder, and she was speaking to Nolan Park, who was nodding with the posture of someone who was hearing things that made him slightly uncomfortable, but not uncomfortable enough to say so. Completely outside her scope. She's an RN. Whatever she did in there, Reyes allowed it, but that doesn't make it sanctioned. The hospital has liability, and someone is going to have to answer for... She became aware that the station had gone quiet. She looked up. She found Elena's eyes and held them, and to her credit, she didn't look away immediately, but she also didn't finish the sentence. Darnell set his pen down. From across the floor, Whitmore turned. The administrator, who had apparently not left, took out a notepad. Petra recalibrated in real time. Elena could see it happen, the rapid internal reordering that was trying to find the version of this moment that preserved her position. "I'm simply noting that there are procedural questions." "There are," Elena said. Her voice was even. She didn't move from the station. "And they should be reviewed by the people who are authorized to review them." She looked at Petra for a moment. "That's not a process I'm afraid of." Petra opened her mouth. Darnell said, without looking up from the chart he'd picked back up. "The serotonin kid from last week, the one you said was a panic attack. His mother called this morning to say he's doing well." The room processed this. Nolan Park took a very small step away from Petra. She said quietly, "That case was..." Also, Darnell continued, the OSE chart from the 12th, the one with the abdominal complaint you cleared as musculoskeletal, he came back 2 days later with a ruptured appendix. Went to the board last week. I don't think the review found physician error, but it's in the file. Elena had not known about the appendix case. She filed it. Petra said nothing. The silence in the room was a specific kind, not hostile, not triumphant, but the kind that happens when a series of separately inconvenient facts have aligned into something that is hard to look at directly. The administrator was writing. I'm going to check on the recovery status, Elena said, and moved away from the station, because she was not interested in standing at the center of Petra's reckoning. That wasn't why she was here. It wasn't why she'd ever been here. She was at the elevator when Darrow caught up with her. There's a woman in the family waiting area, he said. Arrived about 20 minutes ago. She's asking for whoever helped Lily in the ER. Elena pressed the elevator button. That would be the whole team. She's asking specifically. The charge nurse told her there was a nurse who called it early. He paused. She's the mother, Tessa Parker. The elevator doors opened. Elena stepped in, and Darrow came with her. The family waiting area on the surgical floor was a larger, marginally more comfortable version of the consultation room downstairs. More chairs, a window that got actual light, a small table with a box of tissues that was down to its last 4. Tessa Parker was sitting in the chair nearest the door, which was where people sit when they need to feel like they can leave quickly if the news requires movement. She was somewhere in her mid-30s, dark-haired, wearing what appeared to be the clothes she'd put on in a hurry. A sweater with the tag visible at the collar, mismatched socks visible above her boots. She had been crying and had stopped, and the evidence of both was on her face simultaneously. She stood up when Elena came in. Are you... They said there was a nurse who saw something in the ER that the others... My name is Elena Cross, Elena said. I was in the ER when Lily came in, and I was in the OR with Dr. Reyes. Tessa Parker's face did several things at once. Is she... She's stable. She came through surgery. She's being moved to the pediatric ICU, where she'll be monitored closely. Dr. Reyes will come to speak with you directly, but the immediate crisis is past. The woman sat back down. It wasn't intentional. Her legs simply stopped holding her up in the way legs do when the body has been sustaining something enormous and is suddenly told it doesn't have to anymore. Elena sat in the chair beside her. Tessa Parker pressed both hands to her face and breathed for a moment. Then she lowered them. My husband, Marcus. Out of surgery, in recovery. Neurology is reviewing his scans, but the initial assessment is good. They told me She exhaled. I needed to hear it again. That makes sense. They sat for a moment. Outside the window, Denver was doing what it did in December. A low white sky. The kind of stillness that comes before snow. Elena had not looked out a window in several hours, and the fact of there being an outside at all had a briefly disorienting quality. She's 7, Tessa said. She turned 7 in October. She wanted a turtle for her birthday, and we said no, and now I keep thinking about that. About the turtle. Elena didn't say anything. She's going to wake up scared, Tessa said. She hates hospitals. Last time she had to get a blood draw, she cried for 40 minutes before, and then was completely fine during, and then cried for 20 minutes after. A sound that was almost a laugh. She said it was the anticipation. She's right, Elena said. A lot of kids are right about that. Tessa looked at her. Did you know she was going to make it when she came in? Elena thought about the answer to this honestly, because the woman deserved honesty, and not comfort shaped into honesty's form. I knew what she needed, and I knew we could do it if we moved fast enough. That's not the same as knowing the outcome. A pause. She's tough. She fought the intubation the whole way here, which tells you something. Tessa made the sound again, Shab. Not quite a laugh, not quite crying. That is extremely Lily. I believe it. There was a knock at the door. Dr. Reyes came in, still in her surgical cap, and she looked at Elena briefly before she looked at Tessa, And in that brief look was a communication that said several things about the last 90 minutes that neither of them would narrate directly. Elena stood. "I'll give you privacy." "Wait," Tessa said. She stood too. She looked at Elena directly, and whatever she was about to say seemed to be taking shape as she said it, the way the most important things sometimes do. "I don't know what you did in there, but I know it was more than what people expected from you. Someone out front told me what happened this morning, the call on the radio." Elena said nothing. "I just want to say—" Tessa stopped, looked down. "Thank you feels small." "It's enough," Elena said. She left before Tessa could say anything else because she was not built for extended gratitude, and because Reyes had news to deliver, and because in the corridor outside something was happening that she could hear before she saw it. The sound was specific, multiple sets of footsteps, official in their rhythm, and a voice she didn't recognize speaking to someone she could not yet see. She came around the corner from the family waiting area and stopped. 3 people in the corridor. 2 in civilian clothes carrying credentials she clocked from 8 feet as federal, the particular badge configuration of a regulatory body, not law enforcement. The third was a man in military dress uniform. Not Darrow. Not anyone from the 10th. The uniform had different insignia, and the man wearing it was looking at her the way someone looks at a person they've been briefed to find and have now found. He said her full name, not Cross, not Vasquez, the full double-barreled reality of both, and she felt something shift in her chest, some internal structure that had been quietly holding a door closed for 3 months. "Commander," he said, "we need to speak with you." She stood in the corridor of a floor that 20 minutes ago had contained a child bleeding out, and she looked at the 3 people in front of her, and she understood, with the particular clarity that comes from having very little left to spend on ambiguity, that what was coming next was not a conversation she could control or defer or manage into a shape of her own choosing. Whatever she had been hiding behind Elena Cross, RN, was about to become public in a way she had not planned for. She said, "All right." And then her pager went off. Both federal agents reached for their own phones. The man in uniform didn't move. Elena looked at her pager. It was Darnell. The message was 4 words. Lily Parker, waking up. She looked at the man in uniform. "I need 5 minutes," she said. He studied her. "Commander?" "5 minutes," she said again. "The child is waking up and she's going to be scared. I told her mother I would—" She stopped. She had not actually told Tessa Parker she would be there. She had not promised anything. "I need 5 minutes," she said for the 3rd time, and this time it was not a negotiation. The man in uniform looked at her for a long moment. 5 minutes, he said. She was already walking. Behind her, she heard one of the federal agents say something under their breath to the other. She didn't catch the words. She caught the tone, the specific quality of 2 professionals recalibrating their assessment of a situation they had thought they understood. She pushed through the PICU door and found the room. Lily Parker was 7 years old and waking up from anesthesia in the particular graceless, confused way of children coming out of sedation, eyes opening without full comprehension behind them, a hand moving toward the IV line in her arm before a nurse intercepted it gently, a sound starting somewhere in her throat that was not yet a word. Elena came to the left side of the bed. She sat, so she was at eye level. She waited. The girl's eyes found her. Unfocused at first. Then, in the particular way that consciousness assembles itself from pieces, gaining a tentative coherence. "Hi," Elena said. Lily Parker looked at her for a long moment. Then she said, in a voice made rough by the ET tube and weak from everything that had happened to her body in the last several hours, a single word: cold. Elena felt something move through her. Not a wave, not a flood, but a very specific, very human thing that arrived without permission and left no space for professional distance. "I know," she said. "You're not anymore. You're okay now." The girl's hand moved again, and this time it found Elena's wrist above the glove line and gripped it with the instinctive, non-negotiable grip of a child who needs contact with another person and has identified the nearest available one. Elena did not pull away. She sat at the bedside of a child who had survived, in a hospital that was currently rearranging everything it thought it knew about her, with 3 people down the hall waiting to reopen a chapter of her life she had come here to close. And she stayed exactly where she was, because this was the part that mattered, and everything else could wait 5 minutes. Outside the PICU in the corridor, she could hear the footsteps of the man in uniform beginning, slowly, to pace. Lily's grip loosened after about 4 minutes. Not because she fell back asleep. She didn't, quite. But because the immediate animal panic of waking in an unfamiliar place with tubes and lights and strangers began to resolve into something more manageable once her nervous system confirmed that the hand she was holding belonged to a person who was not going anywhere. Her eyes stayed open, tracking the ceiling and then Elena's face, and then the ceiling again. And her breathing settled into the slower rhythm of someone who is scared but no longer terrified, which is a meaningful distinction when you are 7 years old and your body has just survived something it had no language for. Tessa Parker arrived 90 seconds after Elena, slightly out of breath, and the moment she came through the PICU door, Lily's face changed entirely. The particular complete transformation that only happens when a child sees the specific person their body has been looking for without knowing it. Elena stepped back from the bedside without being asked. She watched Tessa take the chair, watched her take both of Lily's hands, watched the girl's face do things that had nothing to do with clinical status and everything to do with the specific human relief of being found. She stayed for another 30 seconds to confirm the PICU nurse had the monitoring parameters correct, and then she left. In the corridor, the man in uniform was still there. He had stopped pacing. He was standing with his hands behind his back in the particular posture of someone who has decided to be patient and is finding it mildly difficult. He was Colonel Victor Strand, Defense Health Agency, Office of Special Operations Medical Programs. He had given her his full title and posting when she'd first come around the corner, with the brisk efficiency of a man who understood that credentials were load-bearing in a conversation like this one. He was in his early 50s, lean, silver at the temples, with the kind of face that had been outdoors in difficult weather for long enough to carry it permanently. The 2 federal agents were sitting in chairs against the wall. They stood when Elena came out. 5 minutes, Strand said. Not accusatory, just noting. She needed a face she recognized, Elena said. Her mother was coming. He accepted this without comment. Is there somewhere we can speak privately? She took them to the consultation room she'd used with Darrow earlier, the small one with the parking structure view, which she was beginning to think of as the room where the day's more consequential conversations happened. She did not sit. Neither did Strand. The 2 federal agents found chairs and opened laptops with the coordinated efficiency of people who had done this particular type of meeting many times before. I'll be direct, Strand said. The Defense Health Agency became aware of your current placement approximately 6 weeks ago. We did not intervene at that point because your service record is clear, and your decision to take civilian employment is entirely within your rights. The situation this morning changes the calculus. How? Elena said. You perform surgical-level interventions in an OR where you are not credentialed as a surgeon. You made clinical decisions in an ER where you were operating as a registered nurse. Both of these create regulatory questions that the hospital will need to address, and which he paused, which we have an interest in framing accurately. Framing, she said. Explaining. Contextualizing. A slight adjustment. Elena, your service record includes documented competencies that exceed what most civilian medical licensing systems have categories for. Field surgery qualification, advanced trauma life support at a combat grade level, emergency surgical decision authority under Article 57 of the Military Medical Command structure. These aren't things that disappear when you take off the uniform. I know what's in my record, she said. Then you know that what you did this morning in that OR with Reyes was within the documented scope of your training, even if it is outside the documented scope of your current civilian role. He looked at her steadily. We want to help you make that case. The 2 federal agents were watching her. One of them, younger, sharp-eyed, with a Colorado State Medical Board badge clipped to her jacket, had a form open on her laptop that Elena didn't need to read closely to recognize as a credentialing review document. "What does that mean specifically?" Elena said. "It means we are prepared to provide the hospital and the state medical board with a full accounting of your training and service record, including the classified components, under appropriate disclosure protocols. It means that instead of facing a licensing review as an RN who exceeded her scope, you would be recognized as a medical professional whose qualifications were simply not visible to the institution." "And what does the Defense Health Agency want in return?" Strand's expression didn't change, but something behind it did. A small shift that acknowledged she had asked the right question. "A conversation," he said, "about your plans, and about a program we're developing that could use someone with your particular combination of clinical and operational experience." She looked at him. "You came here to recruit me." "I came here because a situation arose that required us to be present. The recruitment conversation is a separate matter that I am flagging in the interest of transparency." "But they're connected. They're parallel," he said. "The support we're offering exists regardless of your answer to any other question. I want that to be clear." Elena looked out the window at the parking structure. A car was pulling in on the third level, moving slowly, the driver looking for a space. An entirely ordinary thing happening 40 feet away from a conversation about the last 9 years of her life. "I need to know what's happening with the hospital review first," she said, "before anything else." "Understood." Strand nodded to the woman with the laptop. "Agent Duvall will walk you through the process." The process took 40 minutes and was neither as simple as Strand had implied, nor as complicated as Elena had feared. Agent Duvall, whose full name was Simone Duvall, Colorado Medical Board Liaison, which explained both the badge and the laptop, was organized, direct, and had clearly done her homework on Elena's record before arriving. She asked specific questions. Elena answered them. When there were things she couldn't speak to without a classified disclosure protocol, Strand handled those parts, speaking in the particular shorthand of someone who had navigated this interface between military and civilian record-keeping many times. What emerged over the course of those 40 minutes was a document that accurately described what Elena had done in Bay 1 and OR3 as actions within her documented training scope, supported by 9 years of service records that the hospital's credentialing office had never been given access to because Elena had never provided them and no one had asked. That last part landed on Elena in a way she hadn't anticipated. "No one asked," she said, when Duvall paused to let her review a paragraph. "Your civilian nursing license application required documentation of civilian training only," Duvall said. "Military records require separate disclosure and are not automatically transferred or requested. So, from the hospital's perspective, you applied as an RN with civilian credentials, which were valid, and your military background was simply not part of the file." Duvall looked at her. "That's not unusual. A significant number of veterans transition to civilian health care with more training than their paperwork reflects." Elena sat with this. 3 months of the supply card and the deleted emails and the keep your lane and the note in her file, and part of the architecture of it, not all of it, not the assumptions, not Petra's particular flavor of contempt, but part of the structural invisibility, had simply been a form nobody had thought to ask her to fill out. She wasn't sure if that made it better or worse. "Is there anything else you need from me right now?" she said. "We'll need your signature on the disclosure authorization," Duvall said. "The rest goes through the hospital's credentialing office. Dr. Whitmore has already indicated he'll be cooperative." "Already?" Elena said. "He called administration before we arrived," Strand said. "Voluntarily, he flagged the situation and requested guidance." A beat. "I don't know what happened in that ER this morning, but something changed his approach." Elena thought about Whitmore's face in the bay, the particular expression of a man who had walked into a room and found that he had been fundamentally wrong about something. She thought about the brain bleed patient and the STEMI and the teenager with the temperature of 104 and the note in her file and the demotion to overflow. And she thought about the fact that Whitmore had not tried to manage any of it, had not tried to construct a protective narrative, had simply told administration the accurate version and requested guidance. People were not one thing, she knew. It was one of the more inconvenient facts about them. All right, she said. Where do I sign? But she came back to the ER floor 45 minutes after she'd left it, and the floor she returned to was not entirely the floor she'd left. It wasn't that anything looked different. The bays were the same bays. The station was the same station. The fluorescent lights were doing what they always did, which was illuminate everything with an impartiality that was almost aggressive. But the quality of the atmosphere, the particular social weather of the place, had shifted in the way atmospheres shift when something large has moved through and left a changed pressure system behind it. Darnell was the first person she saw. He was at the station with a chart in his hand, but he was also clearly waiting, and when he saw her come through the door, he set the chart down and said, "Administration was on the floor." "I know. I spoke with them. There's a meeting this afternoon. Department heads and credentialing. Someone from the medical board." He looked at her. "Harmon's been asked to submit a formal account of what happened in Bay 1. "Good," Elena said. "Petra's been asked to submit one too." He said this in a different tone, not satisfied exactly. He wasn't that kind of person, but with the particular careful steadiness of someone delivering information they know has weight. Elena looked up. "On what basis?" "The serotonin case from last week. The one I mentioned this morning." He kept his voice low. Medical board liaison apparently already had a flag on a different case from October. "The appendix." He paused. "And Nolan Park filed something this morning, an hour ago." She hadn't expected that. Park filed? Apparently the thing with Kate Brewer's write-up, when Petra changed the protocol and then wrote up Kate for not following the old one. Nolan had a copy of the original protocol change documentation. He's been holding it. Darnell shrugged, but it wasn't a casual shrug. "I think this morning shook something loose." Elena looked at the floor for a moment. She thought about Nolan Park, who she had categorized as a follower and had apparently not looked at closely enough. "Is Kate's write-up in her file?" she said. "Yes." "Then someone should flag it for review at this afternoon's meeting." Darnell nodded. "Already did," he said. 20 minutes ago." She looked at him. He looked back. There was something in the exchange that didn't need language, the acknowledgement of a working relationship that had existed in the margins of the official one, quietly, for 3 months, doing more than the org chart reflected. "Thank you," she said, "for this morning, for all of this morning." "You would have found a way without me," he said. "I would have found a slower way," she said, which was honest and which he accepted with a small nod. Whitmore's formal apology happened at 2:15 in the afternoon, which was earlier than Elena had expected and more public than she had anticipated. She had not planned for an audience. She had been at the station reviewing Lily's latest PICU vitals, stable, improving, awake for 30 minutes before slipping into natural sleep, which was exactly what she should be doing, when Whitmore came out of the physician's office and crossed the floor toward her with the deliberate pace of someone who has decided to do something difficult and is not going to talk himself out of it. He stopped in the middle of the ER floor, not at the edge of it, not in a corner, the middle, where the light was flattest and there was no furniture to position yourself behind. There were 11 people on the floor at that moment. Elena later counted because she found herself counting things when she was processing. "Elena," he said, and then he stopped and started again, because what he'd prepared apparently needed a different opening than the one he'd arrived with. "I owe you a direct apology, and I'm going to give it here because what I did wasn't private." The floor went quiet in the way it had gone quiet that morning, but differently. Not with shock, not with the sudden collective attention of people who've heard something impossible, but with the quieter attention of people who understand they are watching something that matters. "I put a note in your file in early December," he said, citing clinical overreach. "I transferred you to overflow. I did both of those things because I had made a determination about your competence based on assumptions I never examined, and on information I never actually had. I took credit, in a department presentation, for diagnostic thinking that was yours. I allowed a culture on this floor where your contributions were either dismissed or attributed to other people." He paused. "I did all of that. And what happened this morning, the child who is alive in the PICU right now, happened because you were here and because you did not let any of what I did stop you from doing your job. 11 people in the room, none of them moving. I'm going to request that the note be removed from your file, Whitmore said. I'm going to correct the record in writing on the presentation, and I'm going to recommend to administration that your role here be formally reassessed to reflect your actual qualifications. A beat. If you want to stay. If you want to stay. Elena looked at him. She thought about everything she could say to him, the careful, calibrated responses she'd been composing in the back of her mind for weeks. And she also thought about the fact that none of those responses were actually what she wanted to say, which was simply, "This is what it cost me." Not the overflow assignment, not the file note, but the daily erosion of being in a place where your best work was invisible, where the correct call was routed around you, where the supply cart was the ceiling of what you were permitted to be. That was what it had cost, and it was not a small thing, and she was not willing to pretend it was. "Thank you for saying it here," she said. "I'll need some time before I know what I want." He nodded. "Take what you need." It was not a resolution. It was not a repair. It was a beginning of something that might eventually become one, and she respected him enough for offering it in public to give it that much. Behind her, she heard Kate make a sound that was very small and very quickly suppressed. She didn't turn around. Petra Hollis had not been on the floor for the apology. Elena only learned this later, that Petra had been in a closed meeting with the department head and the medical board liaison since 1:30, that the meeting had not been voluntary in any meaningful sense, that Nolan Park had been asked to attend as a witness to the protocol documentation he'd submitted. What Elena witnessed was the aftermath. Petra came back to the ER floor at 3:20. She had changed something about her posture in the meeting. Not broken. Petra was not the kind of person who broke visibly, but compressed, as if she'd returned from somewhere that had been smaller than expected and had not yet adjusted to the available space. She went to the chart she'd been working on before the meeting. She picked up her pen. Darnell said, from the station, "The brewer write-up is being reviewed." Petra didn't look up. "I'm aware. Administration flagged 3 other cases under your name from the last 2 months, alongside the appendix." Now she looked up. "That's a routine clinical review process." "Sure," Darnell said. "The medical board liaison is staying on site until Friday. That's not usually how routine reviews work, but okay." The silence that followed had a different texture than the earlier ones. Not the silence of a room processing something large. The silence of a specific person processing something they had been, until very recently, confident they could contain. Elena watched Petra's hand on the pen. The pen was still. Then it moved, slowly, completing a signature on the bottom of the chart, and Petra set it down. "I'm going to get coffee," Petra said, to no one in particular. She left the floor. She did not come back for an hour, and when she did, she went directly to her charts and spoke to no one, which was a marked departure from the Petra who had occupied this floor for the last 3 months. The one who filled space, who appointed herself to conversations she hadn't been invited to, who had a positioning instinct that Elena had long recognized as the particular strategy of someone who knows their actual clinical standing is not strong enough to speak for itself. The board review was not a verdict yet. Elena knew that. These things took time, generated paperwork, produced outcomes measured in months rather than hours. But the flag had been placed, the documentation existed, and the culture on this floor that had permitted Petra's particular brand of authority had been named publicly by the department head. The name alone changed the physics of the room. Captain Renner was discharged at 4. Sergeant Oyalaran would stay overnight for observation and leave the following morning. Before Renner left, he found Elena at the station and shook her hand with his good arm, the right, the non-fractured one, with the grip of someone who would have used both if he could. "Tell Lily Parker she's got a story to tell," he said. "She's 7, Elena said. "She'll tell it to everyone who will listen for the next 20 years. He almost laughed. "Yeah." He held her hand for a second more. "Come back, Elena, whatever you're working out here. When you're done, we need people like you." "You need people, period," she said. "What you have is fine." "That's not the same thing, and you know it." She released his hand. Travel safe, she said. Get the radius looked at in 48 hours. Yes, Commander. After he left, she stood at the station for a moment with nothing immediately demanding her attention, which was an unusual condition, and she wasn't sure what to do with it. The ER was running at normal volume. Kate was managing intake on the far side of the floor. Darnell was on the phone with a specialist. Whitmore was in his office with the door partially open, visible through the glass, doing paperwork. Petra was at a corner workstation, head down. Nolan Park was at the station 2 feet from Elena, reviewing a chart, and when she glanced at him, he looked up and held her gaze for a moment without quite knowing what to do with his face, and then he said, "The protocol thing. I should have said something sooner." "Yes," Elena said. "I know." He looked back at his chart. "I'm saying it now." "I heard you," she said. Not warmly, not coldly, just accurately. Darrow stopped by at 4:30 to say goodbye. He was heading back to base. The helicopter had been cleared and refueled, and the mission clock didn't pause for hospital politics. He found her in the supply room where she was finishing the afternoon restock, which she was doing because it needed to be done, and because the physical routine of it was grounding in a way she wasn't going to try to explain to anyone. "Strand give you his pitch?" Darrow said, leaning in the doorway. "He flagged it," Elena said. "We didn't get into specifics. You going to listen?" She counted gauze rolls. "I don't know yet." "That's more than a no." "It's also less than a yes." She moved to the next shelf. "Are you recruiting me too, Darrow? Is that what this is?" "I'm a flight surgeon," he said. "I don't recruit. I just observe things and then describe them accurately to people who ask." A pause. "You were good today, Elena. You were—" He stopped, and she could hear him searching for the word that was actually the word. "You were yourself today. Maybe for the first time since you got here." She kept counting. "Go fly your helicopter, Darrow." "On my way." But he didn't move from the doorway immediately. "For the record, whatever you decide, both ways." "I know," she said. "Thank you." She heard his footsteps move away. She finished the gauze count. She moved to Celine. The restock took 12 more minutes. When she was done, she stood in the supply room for a moment in the particular quiet of a space that has been organized into order. Everything in its place, everything counted, nothing missing. Then she went back to the floor. At 5:47, Harmon found her at the station with a face that held something Elena didn't immediately have a category for. Not urgency. They'd had enough of that today. Something more specific. "Credentialing sent over the preliminary findings from this afternoon's meeting," Harmon said, keeping her voice low. "I thought you should know before it goes to official notification." "What did they find?" Harmon looked at her steadily. "On your end, the surgical intervention in OR3 is being reviewed under emergency privilege provisions. Strand's documentation arrived an hour ago, and the board liaison has flagged it for expedited review. The expectation is that the outcome will be favorable." "And Petra?" Harmon's expression did something careful. 3 cases flagged for clinical error review. The appendix case is being escalated to a formal investigation. The write-up on Kate Brewer is being reversed." A pause. "She's been asked to step back from attending supervisory responsibilities pending review." Elena absorbed this. "How long will the review take?" "The formal process? Months? The immediate step back. That's already in effect." Harmon looked at her. "Elena, there's something else." "Tell me." "The October brain bleed case," Harmon said. "The imaging you flagged through Darnell to Dr. Fenn." Elena waited. "Whitmore's department presentation last month. The one where he described the diagnostic thinking as his own. There was a timestamp discrepancy in the chart. Someone in credentialing noticed it today when they were pulling the record." Harmon kept her voice very even. "The chart shows the imaging was ordered 11 minutes before Whitmore was on the floor." Elena went still. "He wasn't here when the decision was made," Harmon said. "He couldn't have been the one who he took credit for a call he didn't make and wasn't there to make." "He knows that," Elena said. "Yes, and he's known it the whole time." Harmon looked at her. He told administration this afternoon, voluntarily, before the credentialing team found the timestamp. He submitted a written correction. A beat. I'm telling you because I thought you should hear it from a person, not a notification email. Elena stood with that. The timestamp, the presentation, the 9 weeks between December and now where Whitmore had known exactly what he had done and had said nothing until a child's life and a set of federal credentials had made the architecture of it impossible to maintain, and then had chosen to correct it before he was caught. She didn't know what to do with that. The two things, the original act and the correction, sat beside each other in her mind without resolving into a single assessment. He had stolen from her, and he had given it back. Those were both true at the same time, and they would continue to be true at the same time indefinitely. Thank you, Luce, she said. Harmon nodded. She started to walk away, then turned back. For what it's worth. What you did today. Renner, Oyalaran, the girl. The whole floor saw it. She paused. Some of us saw it before today, too. We just didn't have the words for it. She left. Elena stood at the station. The ER moved around her. Monitors, voices, the distant sound of the bay doors. The ordinary machinery of a place that takes in broken things and tries to make them whole, imperfectly, under bad lighting, with insufficient staff and too much paperwork, and people who are doing their best and sometimes failing and sometimes not. She had thought, when she came here 3 months ago, that quiet was what she needed. She had been right, and she had also been wrong in the way you are wrong when you confuse the symptom with the diagnosis. At 6:03, her phone buzzed. An unknown number, but a Colorado area code. She answered. The voice on the other end was not Strand. It was a woman she didn't recognize, speaking in the measured tone of someone delivering information rather than having a conversation. Ms. Cross, this is Director Vega, Office of Hospital Compliance, Colorado Department of Health. We've been briefed on today's events at Riverside Haven, and we'll be conducting a formal site review starting Monday. A pause. We've also received a separate complaint filed this afternoon against the hospital. Elena frowned. By whom? I'm not able to share the filer's identity at this stage, Vega said, but I can tell you it was filed by a staff member, and it concerns a pattern of credential suppression and workplace retaliation affecting nursing personnel. Another pause, smaller this time. The complaint names Dr. Marcus Whitmore and Dr. Petra Hollis, and it names you, Ms. Cross, as a documented subject of the described conduct. Elena said nothing. I'm calling because you'll be contacted formally Monday morning, Vega said. But given everything that happened today, we felt you should have advance notice. A beat. Is there anything you'd like to say at this stage? Off the record? Elena looked across the ER floor. At Darnell finishing his call. At Kate walking a patient toward Bay 4. At Whitmore's office, where the light was still on and the door was still open. At the supply cart by the wall, fully stocked, everything in its place. Who filed the complaint? She said. I can't share that. Was it filed today? A pause. Yes. After 6 o'clock? The timestamp shows 5:52. 5:52. 8 minutes after Harmon had walked away from the station. Elena ran the floor in her mind. Who had been there? Who had been close enough to hear? Who had been watching the afternoon unfold with the particular attention of someone taking notes rather than just witnessing? And then she knew. Thank you, Director, she said. I'll be available Monday. She ended the call. She stood with her phone in her hand for a moment. Then she looked up, slowly, toward the corner workstation where Petra Hollis had been sitting for the last 2 hours with her head down. The workstation was empty. Petra's coat was gone. Her bag was gone. Her charts were stacked neatly with a sticky note on top addressed to Nolan Park. She had left the building at some point in the last 40 minutes without saying goodbye to anyone, and the complaint filed at 5:52 was not hers. It was the filing of someone who had been watching the entire day and who had access to 3 months of documentation that Elena had not known anyone was keeping. She looked at Darnell. He was already looking at her. He held her gaze for exactly 1 second, then looked back at his computer, and she could see from where she stood that he was not reading the screen. He was simply looking at it, The way you look at something when you've done a thing and are waiting to find out whether it lands the way you intended. He had filed the complaint. Darnell Osei, charge nurse, who had pushed through the 12 lead on a man in seat 14 and arranged a CT scan on a woman with asymmetric blink reflexes, and escalated Kate's write-up and flagged 3 months of cases through back channels, had spent 8 minutes on a form at 5:52 and submitted it before the end of his shift. Elena stood at the station of a hospital that was in the middle of investigating itself, with a federal colonel's business card in her pocket and a medical board review in progress, and a 7-year-old girl asleep in the PICU and a charge nurse who had apparently been building a case since October. She walked to his station. He looked up. "How long?" she said. "The documentation?" He shrugged, but it wasn't casual. "I started keeping records in November, after the presentation." He held her gaze. "I wasn't going to say anything unless something changed." "Something changed," she said. "Several things changed," he said pretty dramatically, all in one morning. She looked at him for a long moment. "Darnell." "Yeah." "Thank you," she said. It was the second time she'd said it to him today. The weight of it was different this time. He nodded. He looked back at his screen. Then, without looking up, "You still on overflow assignment?" She thought about the formal reassessment Whitmore had promised, the credentialing review in progress, the Monday site visit, the conversation with Strand that hadn't happened yet. "Technically," she said, "because the cart in Bay 3 still pulls left." She looked at the cart. She looked at him. "I'll put in a third request," she said, and she went to get the forms. The maintenance request form took 4 minutes to fill out. Elena wrote it carefully, completely, in the same handwriting she used for everything. Small, legible, no shortcuts. Bay 3 cart, left wheel drag, third submission, date and time, and her name at the bottom. She put it in the facilities inbox and went back to the floor. The ER ran until 9 without major incident. A dislocated shoulder, 2 flu presentations, 1 elderly man with a urinary infection that had been misread by his primary care physician as something more serious. Elena worked her overflow assignment with the same completeness she had brought to every shift for 3 months, because the work was the same work regardless of what had happened around it, and the patients in the waiting room had not been present for any of the day's revelations, and deserved the same attention they would have received on any ordinary Tuesday. She drove home at 9:20 in a car that needed an oil change she'd been postponing, and she sat in her parking lot for 4 minutes without getting out. And then she went inside and heated soup from a can and ate half of it standing at the kitchen counter and went to bed. She did not sleep well. She hadn't expected to. The following week arrived in the particular way weeks arrive after something large has happened, each day carrying the residue of the event while also demanding to be treated as a separate thing. The Monday site visit from the Department of Health brought 2 reviewers who spent 6 hours on the floor with clipboards and questions, and who were professional and thorough, and whose presence changed the atmosphere of the ER in the way the presence of any external evaluator does, not by finding specific things, but by reminding everyone that specific things could be found. Elena gave her formal statement on Monday afternoon in a conference room on the administrative floor with a court reporter present, and Director Vega on video call from Denver. She was there for an hour and 40 minutes. She answered every question directly and completely. She did not editorialize. She did not minimize. When they asked about the supply card and the file note and the overflow transfer and the presentation where her diagnostic thinking had been attributed to someone else, she described each event in sequence with dates, and she kept her voice even throughout. Afterward, Vega told her the review would take 6 to 8 weeks. Elena said she understood. She went back to work. Whitmore's written correction to the department presentation record was submitted formally on Tuesday. It was a 3-page document that Elena was not required to read and did not seek out, but which Harmon described to her briefly in passing. Accurate, complete, the kind of thing that is harder to write than it looks because it requires a person to put their name on a specific accounting of what they did and did not do without softening the edges. Harmon said it had landed on the department head's desk that morning, and that no one was particularly happy about what was in it, and Elena said that seemed appropriate. Lily Parker came out of the PICU on Wednesday. Elena knew because Tessa Parker texted her. She'd given Tessa her number at some point during the PICU visit, and had not particularly thought about that decision until her phone buzzed on Wednesday morning with a message that said, "She's moving to a regular room. She keeps asking about the nurse with the steady hands. I think that's you." Elena read the message twice. Then she typed back, "Tell her the hands aren't always steady. Tell her she was tough enough that it didn't matter." Tessa responded with a single word: perfect. The formal credentialing review from the state medical board arrived in writing on Thursday, faster than anticipated, which Duval had told her was consistent with cases where the supporting documentation was unusually complete. Elena's military service record, filed under the expedited disclosure protocol Strand had arranged, had apparently answered most of the review board's questions before they'd fully formed them. The document used the phrase "documented emergency privilege" and the phrase "scope," consistent with training record, and the phrase "no finding of misconduct," and several other phrases that were precise and official, and that collectively amounted to the board saying, what she did was within what she is qualified to do, and the institution's failure to recognize that qualification was the institution's failure. She read it twice, standing at her kitchen counter again, with better soup this time. Then she called Strand. He picked up on the second ring. "Commander?" "The board finding came through," she said. "I know. I received a copy this morning." A pause. "Are you calling to discuss the other conversation?" "I'm calling because I said I'd listen after the review was resolved," she said. "It's resolved." He was quiet for a moment. She could hear the background sounds of wherever he was. An office, she thought, something with climate control and carpet. "I can come to Denver Friday," he said, "or I can send the program documentation and we can talk after you've read it." "Send the documentation," she said. "I'll call you next week." "All right." She was about to end the call when he said, "For what it's worth, Elena, the way you handled the last 3 months, the patience of it, most people would have. Most people are dealing with less complicated reasons for patience," she said. A brief silence. "Fair," he said. She ended the call and finished her soup and went to bed at a reasonable hour for the first time since December 23rd. The formal departmental reckoning, when it came in pieces rather than all at once, which was how these things actually worked as opposed to how they worked in the version of events where everything resolves cleanly and simultaneously at a single appointed moment. Petra Hollis's step back from supervisory responsibilities became permanent in the second week of January, formalized in a memo that cited the ongoing clinical review and used language that was careful and institutional and that everyone on the floor understood to mean exactly what it meant. 3 of the flagged cases resulted in formal findings of clinical error. The appendix case was escalated further, to the hospital's Quality Assurance Board, then to the state licensing body. And by the end of January, Petra's medical license was under active review with conditions attached that significantly restricted her independent practice pending the outcome. She did not return to the ER floor in any meaningful capacity. She appeared occasionally in administrative corridors, moving with the careful containment of someone who has learned that the space they used to occupy is no longer available in its previous dimensions. Elena passed her twice in the first week of January and said nothing and was said nothing too. And that was the correct amount of communication for what existed between them, which was not a relationship but simply a documented history. Nolan Park, for his part, became someone Elena revised her assessment of, slowly, imperfectly, the way you revise assessments when the new data is not dramatic but simply accumulates over time. He worked his cases carefully. He asked questions when he didn't know things. He stopped positioning himself in relation to whoever seemed to hold the most authority in the room and started positioning himself in relation to the patients, which was where he should have been to begin with. He would probably be a decent physician. He was not there yet. But the trajectory had changed. Kate Brewer's write-up was formally reversed and removed from her file. The day the reversal notice was posted, she found Elena restocking Bay 2 and said simply, "I know it wasn't just me you were protecting." "I wasn't protecting anyone," Elena said. "I flagged an inaccuracy." Kate looked at her. "Okay," she said in the tone of someone who knows exactly what they've been told and exactly how accurate it is. "Thank you for flagging the inaccuracy." Elena handed her a stack of gauze rolls. "Can you put these on the second shelf?" Whitmore was harder. Not because he was hostile, he wasn't, not after December 23rd, but because people who have genuinely reckoned with what they did that are in some ways more difficult to navigate than people who haven't, because they have earned the right to expect some form of acknowledgement that the reckoning happened, and working out what you owe someone for honestly facing their own failure is not a simple calculation. He didn't seek her out constantly. He didn't apologize again. He did things instead, routed interesting cases in her direction when he had the discretion to do so, consulted her on 2 pediatric trauma presentations with a directness that bore no resemblance to the condescension of December, corrected 2 residents who spoke about her in his presence in terms that had the texture of the old assumptions. None of these were large gestures. They were the kinds of things that don't show up in any document and don't get announced in any meeting. They were just what happening looked like when a person had decided to be different. She let him. That was the decision she arrived at, over the course of January, through a process that was less deliberate than gradual. She let him try, and she watched what the trying looked like. And she did not extend warmth she didn't have, and she did not withhold credit he had earned. It was not forgiveness in the clean, completed sense that word sometimes implies. It was something messier and more sustainable, a working relationship between 2 people who had been on opposing sides of something serious and were now attempting the difficult project of being on the same side of something larger. He was not the worst version of himself anymore. She was not the invisible version of herself anymore. They were both somewhere in the middle, doing the work, and that would have to be enough for now. She went to see Lily Parker on a Thursday afternoon in the 3rd week of January, the week before the girl was due to be discharged. She had not planned to go. She had been on the floor, finishing a shift that had run 30 minutes over because a handoff had gotten complicated, and she was in the elevator going down when she found herself pressing the button for the pediatric floor instead of the lobby. She stood in the elevator and looked at the button for a moment and then let the doors close. The pediatric ward was a different climate than the ER. Brighter colors, a mural of mountains and animals along one wall, the particular controlled cheerfulness of a space designed to make children feel less afraid of the thing they were still inside. Elena had spent limited time here in her 3 months. She found the room number from the nurse's station and knocked on the half-open door. Tessa Parker looked up from a chair in the corner where she'd been reading. Marcus Parker was in the second chair. He'd been discharged from his own admission the previous week, and he was moving carefully with the particular deliberateness of a man whose femur had recently been repaired. But he was upright and present, and his face, when he looked at Elena, had a quality she didn't know how to absorb quickly. And Lily was sitting up in the bed. She looked like a child who had been through something, because there was still bruising along the left side of her face, fading now from purple to the greenish yellow of the final stage, and her left arm had a small bandage where the last IV line had been. But she was sitting up, and she was awake, and she had a drawing in progress on a lap desk in front of her, something with a lot of blue, and what appeared to be a helicopter. She looked at Elena when she came in. The way children look at adults they've been told something important about, with a focused, evaluating attention that doesn't have the social overlay adults develop. "You're the one who fixed me," Lily said. "I was part of a team that helped you," Elena said. "Mom said you were the one who knew what was wrong." "I had a strong suspicion," Elena said. "Dr. Reyes did the harder part." Lily considered this with the particular seriousness of a 7-year-old processing information she intends to use later. "Were you scared?" Elena thought about that honestly. "I was focused," she said. "There's a difference. When you're scared, you're thinking about what might go wrong. When you're focused, you're thinking about what to do next." Lily looked at her for a moment. "I want to do that," she said. "Which part?" "Be focused instead of scared." She looked back at her drawing. "I was scared in the car. After." "That makes sense," Elena said. "You were 7 years old and something very frightening had just happened." "I'm still 7. "Right. But you said you were cold and that mattered. You were communicating. That's not nothing." Lily looked up again. She seemed to weigh this. "Sergeant Oyelaran said I was brave. He told me." "Do you think I was?" Elena looked at her. 7 years old, bruised, sitting in a hospital bed with a helicopter drawing on a lap desk, asking a direct question and clearly intending to receive a direct answer. She thought about bravery and what it actually was, as opposed to what it was described as in most of the places it got described. And she thought about 11 hours in a mountain ambush, and a man in a tent telling her to know her role, and a child in a waiting room who said she was cold. "Yes," she said. "I think you were." Lily nodded, apparently satisfied. Then she picked up a blue crayon and added something to the helicopter. Marcus Parker, from his chair, said quietly, "We don't know how to thank you." His voice had the quality of someone who had been composing this sentence for weeks and had arrived at the honest conclusion that no composition was adequate. "What you did. What you apparently knew and did anyway, even when—" "Marcus," Elena said gently, "your daughter fixed herself. I just didn't get out of the way." He looked at her. His eyes were doing something he was clearly trying to manage. He managed it. Tessa Parker stood up and crossed the room and hugged Elena, which Elena had not anticipated and did not entirely know how to respond to, and responded to imperfectly, one arm coming up slightly late, her posture not quite adjusting in time, the whole thing asymmetric and brief and genuine. "She asked about you every day," Tessa said quietly. "She'll forget me," Elena said. "That's fine. Children should forget the people who were part of the scary parts." Tessa pulled back and looked at her. "She's not going to forget you." Elena didn't argue. She stayed for 15 minutes. She answered Lily's questions about helicopters and whether military nurses had to run a lot and whether it hurt to get a needle decompression. She answered honestly and calibrated for age, and she noticed that Lily listened the way some children listen, with the complete, uncomplicated attention of someone who has not yet learned to perform listening rather than actually do it. When she left, Lily called after her. "Are you going to come back?" Elena stopped in the doorway. "I'll be in the building," she said. Lily seemed to find this acceptable. She went back to her helicopter. The formal administrative resolution arrived on February 2nd. Not all of it. The licensing board review of Petra's cases was still ongoing and would be for months, but the components that specifically involved Elena, the credentialing review, the workplace complaint filed by Darnell, the internal investigation of the file note and the overflow transfer, and the presentation attribution. The file note was expunged. The overflow transfer was formally designated as unsupported by clinical evidence and removed from her personnel record. The presentation attribution, Whitmore's public theft of the brain bleed diagnostic thinking, was noted in a written finding that cited professional conduct standards and was added to his own file, not as a terminal mark, but as a permanent record. The hospital, in a letter signed by the department head and the chief medical officer, formally extended Elena a position. Trauma nursing specialist, a role that had been created with the specific scope of her qualifications in mind, with a compensation adjustment and a reporting structure that placed her in the actual chain of clinical decision-making rather than adjacent to it. The letter used the phrase exceptional contributions and the phrase demonstrated expertise and the phrase we hope you will consider remaining with Riverside Haven, and Elena read it sitting in the family consultation room on a Thursday morning because the room was empty and quiet and she had come to think of it as a reliable place for consequential reading. She sat with the letter for 20 minutes. She thought about what she had come here for, the quiet she'd been looking for after 9 years of everything that was the opposite of quiet. She thought about whether she had found it and decided she had found something which was not the same thing but might be more useful. She had not found quiet. She had found a place where her work was visible now, which was different, and where the structure had been bent toward a more accurate shape, which had cost everyone involved something, which was appropriate, and where a child was on the pediatric floor getting ready to go home, which was the point. She thought about Strand's program documentation, which she had read twice and which described a training initiative for transitioning military medics entering civilian healthcare, a gap in the system she knew intimately, from both sides of it, and that she was possibly more qualified to address than anyone she had encountered in the last 3 months. She thought about the supply cart in Bay 3, which facilities had finally fixed the previous week. The wheel ran straight now. It had taken 3 requests in 4 months, and a complete restructuring of the department's power dynamics, which was not the efficient resolution, but it was the actual one. She thought about Darnell, who had been keeping documentation since November, about Kate, who had stayed past the end of her shift on December 23rd because she needed to know the girl was okay, about Harmon, who had said good call in an operating room and had meant it completely, about the system of small, accurate acts that had constituted the actual support structure beneath her, invisible in the same way she had been invisible, doing its work without announcement. She thought about what it means to be underestimated. Not the injustice of it, which she had processed, but the texture of it, the daily experience of moving through a space where people have already decided what you are and sorted their perceptions accordingly, so that everything you do is filtered through that decision before it reaches them. It was not only about her, she knew that. Every floor and every hospital in the country had people in that position. People whose competence was invisible because the person looking had decided in advance what they would see. The supply carts, the 12 leads, the CT scans that someone called in from across a waiting room and that saved a life, and that never got attached to the right name. The quiet people, the ones who did the work and absorbed the cost of being disbelieved and kept showing up. She had been one of them, and she had also had the particular advantage of a history that could, when externally activated, make her visible in a way most people in that position never got. She knew this. She knew it was not the same. She knew that Darnell and Kate and the nurses who were still on overflow and the residents who flagged things through back channels because the front channels weren't safe, they didn't have a military radio call coming to reset the board. What they had was each other, and documentation, and showing up again tomorrow. She picked up the letter. She read it one more time. Then she picked up her phone and sent 2 messages. The first was to Strand. I've read the program documentation. Available to talk Friday. I have conditions. The second was to the department head's assistant, confirming her attendance at the credentialing meeting that afternoon. She was not going to solve the whole system by staying at Riverside Haven. She knew that. She was also not going to solve it by leaving, and she had not yet finished what she'd started here. And Lily Parker was being discharged next week, and Elena had said she'd be in the building. She folded the letter and put it in her pocket and went back to the floor. Strand's conditions meeting happened on Friday by video call, and the conditions were 3. That the program include explicit credentialing advocacy for transitioning military medical personnel, that Elena maintain her civilian nursing position at Riverside Haven on a part-time basis during the program's development phase, and that she be listed as a co-architect of the training curriculum rather than a subject matter consultant, because the distinction mattered, and she was done letting the distinction slide. Strand agreed to all 3 without significant negotiation, which told her the program needed her more than the call had implied, and that she had left conditions on the table by not asking for more. She filed that information and decided it was all right. There would be other negotiations. She told him yes. Lily Parker was discharged on a Tuesday, which was Elena's day off, but she had come in to cover a half shift for Kate, who had a family obligation, and she was at the nurses' station at 11:15 when the elevator opened, and the Parker family came out with a wheelchair that Lily did not want to be in and was sitting in under protest, according to the expression on her face. She saw Elena across the floor and raised one hand in a wave that was emphatic enough to communicate significant feeling across 30 feet of linoleum. Elena raised her hand back. Tessa Parker stopped at the station while Marcus navigated Lily toward the exit, and she handed Elena a card-sized envelope. She made it, she said. She wanted to give it to you herself, but she also wanted to be the one pushing the wheelchair, and you can imagine how that negotiation went. Elena opened the envelope. Inside was a piece of paper folded into quarters. She unfolded it. It was a drawing in crayon, the medium Lily had been using in the hospital room, blue and yellow and red. It showed a figure in scrubs, clearly female, clearly a nurse, with what appeared to be a stethoscope around her neck. Above the figure, drawn with the particular commitment of a child who has decided something is important, was a gold star. Not a small star. A substantial star, with 5 points rendered with care, taking up a third of the available space above the figure's head. At the bottom, in the large uneven letters of a 7-year-old who has been practicing handwriting but not for very long, the nurse with the star. Elena stood at the nurse's station with a crayon drawing in her hands, and felt something move through her that she did not have a precise name for, and did not try to name. It was not triumph. It was not relief. It was something older than either of those. The particular, complicated, unneat feeling of being seen by someone who had no reason to look beyond the surface, and had looked anyway and found something worth drawing. She stood there long enough that Darnell, passing with a chart, slowed down and glanced at what she was holding and said nothing, which was the correct response, and kept moving. She folded the drawing carefully along its original creases and put it in the breast pocket of her scrubs, over her sternum, where it stayed for the rest of the shift. At the end of that shift, she did one last restock of the Bay 3 cart, out of habit, out of the same completeness she had always brought to it, because the patients who would use it tomorrow deserved a cart that was fully stocked regardless of everything that had happened around it. She moved through the checklist without looking at it, the items in their correct order, nothing doubled, nothing missing. The wheel ran straight. She pushed the cart back against the wall and stood in the supply room for a moment. She thought about what it had cost. Not to herself alone, she had learned in the last 6 weeks to be honest about what things cost, because honesty was the only basis for anything durable. It had cost Marcus Parker a surgery. It had cost Lily Parker a scar above her left brow that would fade but not disappear. It had cost Renner a radius and Oyalaran 3 ribs. It had cost Darnell months of careful documentation carried in silence. It had cost Kate Brewer a write-up in her file that no longer existed but had existed, and the experience of knowing that the people above her could do that and have no one stop them. And it had cost Elena Cross 3 months of being the Glacier, of being surveilled and diminished and filed in the wrong category, of doing her best work for patients who never knew, and colleagues who either didn't notice or didn't care to look. She was not going to tell herself it had been worth it in some cosmic sense. She didn't think that was how worth worked. She thought worth was constructed, incrementally, by what you did with what had happened, whether you let it close you or whether you used it to understand something that changed how you moved forward. What she understood now, standing in a hospital supply room on a Tuesday in February with a crayon drawing in her breast pocket, was this. The quietest person in the room is not necessarily the person with the least to say. Sometimes they are the person who has learned, through experience that cannot be fully communicated, the difference between speaking loudly and speaking at the right moment. Sometimes they are carrying a history that the room hasn't earned yet. Sometimes they are waiting, not from weakness, not from fear, but from the particular patience of someone who knows that the moment will arrive when the truth becomes undeniable, and that when it does, they will be ready, because they have never stopped being ready, because readiness was never something they were performing. Elena was 34 years old. She had been a combat medic, a commander, a named subject in a federal workplace complaint, and a woman who was called a Glacier behind her back for 3 months in an ER in Denver. She was also, as of 2 days ago, a co-architect of a military to civilian medical transition program, a trauma nursing specialist, and a person who had been told by a 7-year-old that she deserved a gold star. None of these things canceled the others. They were all simultaneously true, the way most real things are, complicated, overlapping, resistant to clean summaries. She turned off the supply room light. She got her coat and her bag from the locker room. She said goodnight to Darnell, who was starting his 3rd consecutive shift and who waved without looking up from the chart he was reviewing because he was already in the next case. She walked through the ER, past Bay 1, past the wall intercom panel where she had pressed a button and said, "Captain Darrow, this is Commander Vasquez," in a voice that had surprised everyone in the room, including, if she was honest, some small part of herself. Past the nurses' station where the overnight crew was assembling. Past the bay doors. Outside, the February air was sharp and cold and entirely present. Denver at night, in winter, with the mountains invisible in the dark, but there. She knew they were there. She had driven into this city 3 months ago and watched them appear on the horizon and felt something settle in her, some decision becoming final. She stood in the cold for a moment, not going anywhere, just standing. She thought about Lily's drawing, the nurse with the star, the figure in crayon scrubs with the stethoscope, and the gold star drawn large enough to matter. There were people in buildings all over this city, in hospitals, in clinics, in emergency rooms exactly like the one she'd just left, who were doing the invisible work, who were calling the right readings and routing the right scans and flagging the right presentations through back channels because the front channels weren't safe, who were being told to keep their lanes and being transferred to overflow and having their file notes written against them, who were competent in ways the institution hadn't built forms to measure, in ways that required someone to actually look instead of assuming they'd already seen. She couldn't fix that by herself. Nobody could. It was a systemic problem with systemic roots, and it would require systemic solutions built by people who understood it from the inside, and those people existed. And some of them were just now becoming visible. And some of them were standing on the floor of a hospital somewhere tonight still invisible, doing the work anyway. What she could do was what she had always done. Show up, be exact, be present, and refuse to disappear. Not loudly, not dramatically, not in a way that required an audience to validate. Just persistently, accurately, with the quiet authority of someone who knows what she knows and has stopped pretending otherwise. She pulled her coat closed. She walked to her car. She had a program to build, a shift tomorrow, a cart in Bay 3 that finally ran straight, and a crayon drawing in her pocket with a gold star large enough that the person who drew it had clearly felt it was the correct size. She started the car. The heater came on. Outside, Denver moved around her in the dark, ordinary and ongoing, full of people in difficult positions doing their best work in rooms where no one was paying attention. She knew how that felt. She also knew it didn't last forever. She pulled out of the lot and drove home.